Hello everyone. This is the breaking news about health. Here is the news. The BA.2 subvariant is now 72% of new COVID-19 cases. Experts say don't panic. Although the subvariant has overtaken BA.1 in the US, cases still remain low nationally. April 6, 2022. The BA.2 subvariant of the Omicron variant continues to rapidly spread throughout the US, now accounting for about 72% of all new COVID-19 cases, according to data from the Centers for Disease Control and Prevention. The new CDC estimate is up from about 55% a week ago, when the subvariant, which is thought to be more contagious than the original strain of Omicron, became the dominant variant of the coronavirus circulating in the country. Despite its spread, health experts see no cause for alarm in the US. That's because there is no indication the subvariant is more severe than the original Omicron strain, and because the high level of immunity in the country from vaccines and previous infections is unlikely to make it a major threat. I would not be hugely concerned about BA.2, said Dr. Christopher Murray, a professor of health metrics sciences at the University of Washington and the director of the Institute for Health Metrics and Evaluation. A sudden rise in BA.2 cases in Europe and other parts of the world last month raised concerns among some health experts and officials that the US could experience a troubling rise in cases, as well. However, COVID-19 case counts remain low in the country. As of Tuesday, the 7-day average of COVID-19 cases is at about 29,000, down by 19% from 2 weeks ago, according to an NBC News tally. Case numbers are increasing in a handful of counties, but most people in the country live in areas with low community spread, the CDC's director, Dr. Rochelle Walensky, said at a news briefing Tuesday. Cases counts are ticking upward in counties in the Northeast, in particular. She encouraged everyone to stay up to date on their COVID-19 vaccinations. Last week, Walensky signed off on a second booster dose of the COVID-19 vaccines for people 50 and older, 4 months after their first boosters. Murray said he expects BA.2 to remain at low levels in the US for at least a few more months as the weather gets warmer. Right now we're in this period where immunity is high and we're heading into the summer and transmission tends to be a bit lower, he said, so the combination should lead in the Northern Hemisphere to pretty low levels after the BA.2 wave. It's still possible cases could spike in the US because of the subvariant, although the spread may be limited to certain areas of the country. It's not unexpected to see a spike in cases, said Dr. Isaac Bogok, an infectious disease specialist at the University of Toronto. To what extent a rise in cases will affect states or countries will depend heavily on their own policies, he added. But any rise in COVID-19 cases can be consequential. People are still going to get sick, some people are going to land in the hospital, and some people are going to die, whether it's a big wave or a small wave, Bogok said. Murray said he is more concerned about the fall, when immunity provided by the second boosters begins to decline, leaving vulnerable groups of people once again susceptible to the virus. U.S. officials appear to be looking toward the fall, as well. Dr. Peter Marks, the Food and Drug Administration's top vaccine regulator, suggested last week that the agency could authorize yet another booster shot for vulnerable people later this year. Murray said another concern is that a new variant could emerge that's more virulent than Omicron and BA.2. The critical issue for everybody is not whether there's a new variant. It's whether there will be a new variant that's more severe, he said. If it's something that's more transmissible than Omicron and more severe, it'll spread so quickly that adjusting vaccines to that new variant will probably not get done in time. Dr. David Boulware, an infectious disease physician at the University of Minnesota Medical School, shared concerns about new variants, although he said antiviral pills from Pfizer and Merck should still be effective. Another article said that the WHO says the BA.2 subvariant of Omicron is driving most cases around the world. The World Health Organization reported that the highly contagious Omicron subvariant, BA.2, that is helping to drive another surge of coronavirus cases in Europe is now the dominant version of Omicron around the world. Globally, BA.2 made up about 86% of cases reported to the WHO between February 16 and March 17, the agency said in a report on Tuesday. The previously dominant subvariants, BA.1 and BA.1.1, together represented about 13% of the cases. BA.2 is already dominant in the WHO's Americas region, and its share of cases has been steadily increasing in parts of Africa, Asia, Europe and the Middle East since the end of 2021, the agency said. When the WHO last reported these figures, on March 8, it said that BA.1.1 was the dominant subvariant and that BA.2 made up 34% of new cases. In the United States, about a third of new coronavirus cases are BA.2, Dr. Rochelle Walensky, the director of the Centers for Disease Control and Prevention, said at a White House briefing on Wednesday. U.S. health officials have said they expect case numbers to rise, but that they do not anticipate a major surge caused by BA.2. While BA.2 is more transmissible than BA.1, it has not been shown to cause more severe illness. And even though the virus has evolved considerably since vaccines against it were first developed, the inoculations still work, Dr. Maria Van Kerkhove, the WHO's COVID-19 technical lead, said in an interview posted on the agency's website on Tuesday. Our vaccines remain incredibly effective at preventing severe disease and death, including against both of the sublineages of BA.1 and BA.2, she said. Scientists suspect that BA.2's rapid growth is thanks to its unique mutations. In the gene for the spike protein on the surface of the virus, BA.2 has 8 mutations not found in BA.1. Although BA.2 has become the latest subvariant on many people's minds, there are also 3 so-called recombinant variants that the WHO has deemed noteworthy enough to be named. One of these variants, nicknamed Deltacron, was discovered in February but had not been officially named. Editor's Picks. On Tuesday, the agency said that it had named the 3 variants, 2 versions of Deltacron and one that combined BA.1 and BA.2, XD, and XF. There was no evidence that these recombinant variants are more transmissible or cause more severe outcomes, the report said. Dr. Van Kerkhove said that, over the last 2 years, virus surveillance, testing and sequencing have helped countries implement public health measures that have evolved with the virus. Her statement came the same day that a senior WHO official in Europe said that cases have surged in the region because the authorities were too quick to relax pandemic restrictions. Rather than take a gradual, measured approach, the countries are lifting those restrictions brutally, from too much to too few, said the official, Dr. Hans Kluge, the organization's regional director for Europe. Dr. Kluge added that the increase in new cases was linked to the spread of BA.2. Cheryl Gay-Stolberg and Matthew Mbokbig contributed reporting. That's the end of the health news. Thank you for your watching our videos. Please subscribe, like and share videos.